Yeah. So just for fun,
Yeah.
I am asking Gemini, how many floppy disks would it take to make 6 terabytes?
Floppy disk. Oh my God.
And it is approximately 4,069,011 floppy disks worth of data. So 4.07 million floppy disks of data. For those of you who remember floppy disks, maybe that'll put it in context.
Help me with hip hop. Let's get it right. Protect your patience. Day and night. Donna and David, the experts on your side. Help me with hip hop. Let's get it right.
All right, today we're going to connect the dots for you folks because we've been seeing a lot of dots lately.
Quit looking at the sun, David.
I know. Well, they said the eclipse was happening. Thought it would be safe. But anyway, apparently I was not in the line of the eclipse. That said, ransomware headlines, I mean, come on. We talk about ransomware a lot, but sometimes there's you got to read between the lines. You got to see what's not actually apparent to the naked eye. And that's what we're going to be talking about today.
We got 5 different ransomware stories, and when you hook them all together, you're like, uh-oh.
Yeah. It's okay, I'm starting to see something here.
Mm-hmm.
So, yeah, that's what we're talking about today, and get into that because, all these have happened within the past couple weeks or so, really recent. And then we have an OCR settlement, which has to do with ransomware. So we'll talk about that. And I think you'll be able to tell by the way we cover this settlement that it's just take any settlement and just change the name on it. It's the same failures over and over again.
Yeah, but we got all these stories. We got the ransomware settlement. We got an active operational disruption, extortion, madness. Social media is even involved. A Black Fog Q2 ransomware findings report, and then a cute little ransomware group that we're going to tell you about that is targeting the small and medium market because we're too small.
Yeah, it's called the low-hanging fruit.
Yeah, Goldilocks. All right. So when you put it all together, it's a thing. So yeah, it's kind of fun when you put it all together. You feel like you're putting together a puzzle, but then at the end, you're like, that's an ugly puzzle.
Yeah. Well, it's just more evidence that everybody needs to pay attention and do what it takes to protect themselves and their patients, their loved ones, everybody. I mean, it's from a cybersecurity standpoint, it's never been as bad as it is now. And yet people are still going along acting like we just need antivirus.
Yeah. Well, I would love to have some tool that could go back and review, although it would choke on 10 years, going on 11 years of episodes where one of us said it's never been as bad as it is now.
Well, I think that's always going to be the case. It's going to continue to get worse. Our defenses and the way we defend them also get better. So it's not that we have less ways to defend all the new stuff. We have continued to increase our ways to defend, which is why I'm constantly having to look at new vendors, which is why the cost of cybersecurity keeps going up.
Yeah.
I actually looked at one. I looked at a client I had yesterday. I think it was yesterday. And I realized that over the past 36 months, the cost of cybersecurity has more than doubled, and it's not like the cost of the tools have doubled. It's that we're having to add that much more cybersecurity just from 3 years ago, 36 months. We've had to double all the things that we're doing to protect clients.
Mm. See, and we're in a time frame where everything is more expensive, but a lot of things are more expensive just because the price keeps going up. The product doesn't change. In cybersecurity, the product constantly has to change. It's constantly being adapted to whatever the attackers are doing. So it's not like,
Hmm.
oh, look, we're going to get a new feature. No, you have to have the new feature to continue to provide the product in a way that it'll actually work,
Yeah.
which is a whole different ballgame than what other price increases are doing. It's only exacerbated by everything else getting more expensive.
Well, it falls back to your risk, maybe even your risk analysis. But,
Ooh.
um, when everybody's now using AI, whether they know it or not, in most cases. So for us in cybersecurity, it's like, okay, now we have another risk, another threat vector, and that requires yet another tool or the expansion of a tool that we currently have, which means it comes at additional cost. It comes with more operational overhead, all the things.
Mhm.
So as a business, as you start using more and more technology, you've increased your risk profile, and you have to increase your cybersecurity profile to defend that at the same time. So
Well,
it's a
and
never
your
ending
training,
process.
because so often when technical things come out, a new technology, and particularly in this one, people are like, oh, technical people just know how to do it like the next day. No,
Yeah.
no, we have to have really intense training and very specialized training. And we have to do a lot of trial and error to see for ourselves how it works. So there's a lot of time investment that goes with us being able to implement these things. So there's a lot going on that most people don't understand about what is really happening in the cybersecurity world. And all of these ransomware attacks are really telling us something that we should pay attention to now, because what we're telling you about these two pieces hooked together, it's important that you've got the piece we're telling you about of cybersecurity, because the other piece, well, let's just say aggressive is a term that is used several times,
Yeah.
discussing these ransomware groups, and there may be not
Yep.
new, but new tools. So let's hit the OCR settlement announcement. Just came out. 21st ransomware enforcement action.
Hmm.
Now, those have been going on way longer than the SRA, but this one included an SRA, so they called it a ransomware one. So I guess if the event is, an underlying ransomware thing, then everything else, even though the SRA was not done properly, is one of the problems. Then I guess it becomes a ransomware one, because it could technically also be an SRA one.
Yeah. I would have done both, but I guess I had to pick one.
Yeah. So they announced this July 29th. I didn't look to see when they sign it, because they're not announcing them right away lately, or maybe they've changed. Anyway, the ransomware incident happened April 23rd, 2021.
Ooh,
So,
that's a day or two ago.
yeah, yeah. A lot of other things are very different in the world than it was at that time. And so 5 years. And this is where we tell you the incident isn't like the thing. It goes on. So this has been happening for 5 years. They've been dealing with this thing. And
Yeah.
now
And it's not over.
it's not
It's
over,
not.
because $552,250 resolution amount and a 2-year corrective action plan.
Yeah.
So they got 2 more years. So 7 years at least this will be going on. But
Wow.
the disclosure was 53,907 individuals. Data was stolen. It was, exfiltrated. And the investigation found they had not done a accurate and thorough risk analysis. And by not doing that, then there was an impermissible disclosure of PHI. And then we're starting to see this more often. They failed to do a timely notification to individuals, failed to do a timely notification to HHS.
Yeah.
Yeah,
Which,
we got to look into
you
that
know,
one further.
but those two things are like, okay, like after an incident happens, like you're screwed on the risk analysis. You can't go back and do it at that point.
No.
But you can handle the incident properly. You can do the timely notifications.
Yeah.
So you still have some things under your control that you could do right, but didn't happen in this case.
Yeah, and this is a healthcare system.
Mm-hmm.
So, OSF healthcare system. So we're not talking about, well, anyway, you want to get on the official director's statement, which is what we're supposed to learn from this announcement.
So the OCR director, Paula Standard, says an accurate and thorough HIPAA risk analysis is not only required by law, but it's also necessary to protect PHI and prevent and mitigate ransomware attacks. If a HIPAA regulated entity doesn't know what threats and vulnerabilities exist to its ePHI, they'll often learn the hard way when their systems are hacked. How very true. How very true.
That's like a knife in the back when. Mm-hmm.
Yeah. It's you can tell she's starting to settle in good. She's starting to go, you know what?
Yeah.
Why I gotta keep repeating myself?
Mm-hmm. Is this really?
Don't let me tell you again. Yeah.
People are often shocked when they get in and see what's really happening behind the curtain.
Yeah.
But they want a real risk analysis. And this is something that we have been talking about over and over and over again. People have, for decades, literally decades, acted like this is no big deal. Oh, anybody that makes that, they're making it too hard. That's not the way we do it in X. You know, we don't do it that way in dental. We don't do it this way in ASC. We don't do it this way in this. We have been doing it wrong, if that's what you're saying. I'm just saying.
Yeah. Well, I mean, aside from HIPAA, if you're going to protect anything, the first thing you have to do is understand where the stuff is you have to protect. Like if you walked into somebody's house and they're like, I need you to protect my valuables. Okay, well, where are they?
What are they?
And yeah, what are they? Who am I protecting them from? What am I protecting them from? What tools are at my disposal? I mean, think about it in terms of just a very, bring it way down.
Right.
If that's what you're asked to do, this is the same thing. Like you can't walk into somebody's house and they go, protect my jewelry. Okay, well, where is it? I don't know where it is. I just need you to protect it. Well, I mean,
how much do you have?
Yeah. Like, is it under the house? Is it in the attic? Is it in a certain room? Is it all in one place? Or they tell you, oh, all of our jewelry is in this jewelry box. And you're like, well, what about the jewelry over there on the counter? Oh, well, we forgot about that.
It's not always there. It's just sometimes there.
Yeah. And it's like, well, what about the jewelry you're walking out the door with? Am I protecting that too? I mean,
yeah, that's the way to look at it.
Thought exercise,
Yeah. I mean, you need to have a process that you're following and that you can prove you're following. A defendable security program.
Mm-hmm.
And just so, well, we'll call it, in other news, other related news, we get clients that are in the middle of an investigation who want us to help supply the requested documentation. This is something we've talked about repeatedly. We do this. We know. Not our first rodeo. Not our last, we're sure. But we just saw a new one asking for something we'd never seen before, David.
Uh-uh.
And the lawyers, when the official conference call about it happened, the lawyers were also pointing out, we've never seen this before. We're like, us either. They were asked, we always expect to be asked for, show us your most recent risk analysis and associated risk management plan. Show it if that's the one you did after the incident. Show us the one before, the most recent before that, or sometimes even two before that. This asks for 6 years worth of risk analysis documentation.
Oh, wow. So they wanted all of it.
Yeah,
Like we can
6.
go back 6
Yeah,
years and we want to see all 6 years.
yeah. So 6. Never seen a mass pro. 6 full years.
Wow. So
Never.
what do you think about that? Is it, you think it's unique, or you think this is like the new standard moving forward?
What it's saying to me is our discussion about the changes in the security rule are going to be directly related to properly doing a risk analysis so that you're forced to see if you do them properly. Like I have this approach that says, I want to see the actual risk I face, the inherent risk just for operating in the world we are today. And then we take into account, what do you plan to do about that? How are you doing on doing that? How are your controls? Can you prove? Is there evidence there? Because only if there's evidence there and you actually have a plan for if it goes wrong, can I say that you've reduced that actual risk? So we then rate all of those things and we have residual risk. And so now I can see this is bad, but here's how we're doing on stopping it. And so often people will go in and they'll just reduce their risk down to low on everything, or medium low, because no one can just make a decision. And what we're seeing is that then everything's low and you just don't worry about it anymore.
Hmm.
My approach says you should always worry about it. It's what we say. We always worry about it. But the residual risk then allows me to see, how well are we doing? And that can change. When we add AI to all of our risk analysis, which is a little freaky for people because we've now added all these AI line items on our threats and vulnerabilities. And, we've started doing the annuals with a lot of our clients with all of my updates I've made, because I got to up the game, right, Boo?
Oh yeah.
So what I see is this here shows you just how serious the requirements for the risk analysis are going to be in the security rule updates, because that's where a big chunk of the updates were, because they said it's the number one thing everybody does wrong.
Indeed.
So they're gearing up for that right now. They're getting the evidence they need to decide how to approach it.
All right. Well, if that's not concerning enough, let's talk about the ransomware incident happening in healthcare.
Yeah. You sent it to me. I was on a road trip, so you send me AndMed, and they operate in South Carolina and Georgia. Were you familiar with them?
No, I wasn't,
Me
but
either.
I got alerted from a family member. They were like, the hospital's having a ransomware attack. And I'm like, oh Lord. Cause I'm in a small town. So I was like, it's going to be interesting. And so I started looking, and I'm like, well, I can't find anything about our hospital system. And so I started digging a little bit more. I'm like, oh, this is right down the road. This is over in Anderson, South Carolina. It's a different hospital system, but it affected like 80 something or 100 and something of their external offices and practices. So it hit close to home, but it was, out of Anderson.
Yeah, it's I don't remember how many they said, but it was like 100 and something, 80% of them impacted. They had network access failures, internet access, phone service. The patient portal was down. They couldn't do imaging, laboratory scheduling, canceling elective procedures, oncology and radiation services. I can tell you how much stress that was creating in the world around them.
Yeah.
Just having to be the patients and their families when you're going through oncology and radiation. It has to happen on a regular basis or it kind of screws everything up.
Mm-hmm.
So almost all of their locations, they initially just closed them or were barely operating, and their downtime procedures were activated. They did have emergency departments open. That's nice
Yeah.
that they didn't divert and announced that clinical decisions involving procedures, transfers, diversions, and operations made around patient safety. So,
Yeah. Good.
but then it says patients are advised to bring their medications and printed lab orders. Yeah.
Huh.
So supposedly the group that's done this is known as the Gentlemen.
Oh, that's nice.
Yeah.
How gentleman can you be whenever you're potentially going to put people to death?
Yeah.
Oh boy.
And yeah. And there's plenty of articles and links, of course, in the show notes on the website. But there was this a threat intelligence briefing, and a couple of articles got my attention. The Gentleman Ransomware Group is scaling faster than any other group on record. That was from May. Like,
Yeah. And this is ransomware as a service.
correct.
So they allow entrepreneurial spirited people with malicious intent to use their services to attack people, and they don't have to have any technical skills because, again, ransomware is a service. They're paying for the service. The ransomware happens, and then you get a cut of it.
Yeah, and so the threat briefing, there were 3 quotes I grabbed out of there talking about them. Remember where I mentioned the term aggressive?
Mm-hmm.
So the big thing is ransomware as a service, normally 80-20. We'll take 20% and you get 80% of the ransomware income. You use our tools, we'll let you use our tools, we'll take 20. Well, they're doing 90-10.
Yeah, on the revenue split instead
That's
of the
that's
80-20.
huge.
Yeah, that's that's an industry disrupting business model. I mean, you're going to give me 90% of it? Heck yeah. I'll use your service versus the competition.
Yeah, and so as this article said, it's triggered a mass migration of top tier affiliates, because that's what they call them, affiliates, from the other ransomware as a service programs. So this is pressure on that market.
Yeah, race to the bottom.
It's its own thing, and they've even established an official partnership with the Breach Forums marketplace so they can recruit penetration testers and initial access brokers, which we've told people about this.
Yeah.
There's these brokers that all they do is get the foothold and then they sell that and they're off. That's their big thing. But when they said they are operating primarily as a highly aggressive ransomware as a service and this unprecedented 90-10 split, aggressive recruitment campaigns, but then lasting affiliate loyalty. So once they get them, they're staying, and distribution of advanced, centralized endpoint detection and response killer suite known as the Gentle Killer.
How sweet. What
does that say to you as the guy that, as we previously discussed, is responsible for keeping them out?
It's yet another thing to worry about, but it's also indication that there has to be defense in depth. There has to be layers and layers of stuff because you can't just rely on EDR. And
and that's what so many do, don't they? Don't they say, well, we have such and such EDR, we don't have to worry about it?
Well, in some cases, that's all anybody asks for. Like when they go to get insurance or whatever, do you have EDR? Yes. Okay. Or, it's the whole antivirus conversation again. Well, we have antivirus. We're good. Well, we have EDR. We're good. I'm like, no, no, you're not. It's like living in a extremely high crime, aggressively high crime area. And you're like, yeah, but I got a deadbolt. Okay, but that's not going to really help you here.
Yeah, I
Not
think we need
much.
to.
I mean,
I need to reach out to Gary at Black Talon, Gary Salmon, and get him to come on again and talk with us about the current environment and how it is so different yet still the same. You know,
yeah,
and I
yeah,
was talking with some of those guys and talking about the EDRs and the MDRs and all this, and they're like, "Yeah, we have one we use, but we don't count on it
yeah.
because
I
you shouldn't."
mean, it's the thing is like we're doing everything we can to stop an incident from happening, but plan on it happening.
Yeah,
You know?
you just have to do that. So this ANMED attack started on July 26th, as far as anybody knows. That's the date it started, or that's the date of boom, we'll call it. We don't know
Yeah.
when they actually got in, but date of boom, July 26th. Here was an update on August 10th. 10 facilities are closed. So
Yeah. What do you
still,
mean? They're not back in business the next day?
I know, right? Yeah,
Yeah.
it's 15 days closed. They're still doing forensics. The full restoration timeline remains uncertain.
Yeah. So they still aren't fully functional.
Yeah, and they're not confirming much of anything as far as ANMED goes. They haven't confirmed what was included. They have told the patients to be cautious with electronic communications appearing to originate from the organization.
Yeah, I did see that. I looked at this on Monday just to kind of get a recap of what was happening to date. And as of Monday, they had started sending out letters and communications to patients because there's going to be, or there maybe was signs that the ransomware group was reaching out to patients directly and trying to scam them and all that.
Mm-hmm.
But the next day, even more changed.
But wait, there's more.
I know, because Tuesday, which I haven't looked at it since Monday, so I found out today that on Tuesday it got even worse.
Yeah, this part, I don't know I've ever heard one doing this. Have you?
No, not that I can recall.
Unauthorized posts appeared on ANMED's social media accounts.
Yeah, I now don't want to know what the posts were.
I know they were removed approximately 30 minutes later, but access to Facebook is now disabled. But the bottom line is the bad guys are we're assuming the bad guys are posting it because they say they did it.
Yeah,
The unauthorized messages had imagery associated with the Gentleman Ransomware Group, which they have their own little logo. Isn't that cute?
yeah. I mean, it's branding. You got to brand yourself. I mean, you're running a lucrative and aggressive ransomware as a service, and you're trying to get market share.
Uh-huh. And then the part, so they claim possession of highly sensitive clinical and personal information, including things like HIV status, suicide registries, sexual assault and rape, mental health, abortions, genetic information, social security numbers, dates of birth, autopsy, and police evidence.
Yeesh.
Right? And they
Wow.
said they were going to add it to their dark web leak site. But the thing that I remember hearing you when we first started talking about these notes, your voice got a little higher when you were talking about the amount of data. Go ahead. Let's just hit that.
Yeah. Yeah. So far, they've said that they've got 6 terabytes. Now, for the average person, they might not know what that means, but that's a lot. That's a lot.
Yeah, 1 or 2 terabytes is a lot. It's 3 times
Yeah.
a lot. So I don't know what we call it. I guess, like you
Yeah.
said, it's a lot, a lot, a lot.
Yeah. I mean, considering most business machines come with a half a terabyte, you would have to have 12 computers worth of data slap full.
Slap full. You sound
Slap
Southern.
full. I is.
I mean, 6 terabytes is a ridiculous amount of data. We don't know. They have no evidence of it, but we don't want them to give us evidence of it, because if they have it, we don't want them releasing it. And there's nothing public that verifies any of this. They did say there were unauthorized, as they put it, unauthorized posts on our social media, but the claims in the unauthorized posts have not been verified. They are under investigation. And notifications will be made if the investigation confirms personal information was affected.
Wow.
Yeah, 6 terabytes.
Yeah. So just for fun,
Yeah.
I am asking Gemini, how many floppy disks would it take to make 6 terabytes?
Floppy disk. Oh my God.
And it is approximately 4,069,011 floppy disks worth of data. So 4.07 million floppy disks of data. For those of you who remember floppy disks, maybe that'll put it in context.
Was it the 3.5, which were high density?
Yes, 3.5 high
Not
density.
the 5.25, which
Not the 5.25. Nope.
Oh, wow.
So imagine your floppy disk from high school to college, and there's over 4 million of them data on it stolen.
Let's see. When you say we need an analogy of how much 6 terabytes really means, I'm just gonna ask that, not the floppy disk, because I made a joke one time about how far things have come since I've been in this world, and how exciting it was that we got rid of the 5.25 floppies and we went to the 3.5, because those were hard plastic and they were small. They would fit in your back pocket. So then I was cool. I was carrying my data with me. Okay, so I said 6 terabyte represents a significant volume. We've already said that, Gemini. Document scale, 600 million pages of text.
Wow. It's also 8,139 standard CD-ROMs of data, if you remember burning your own CD-ROMs.
But then it says, in a healthcare record environment, a single patient chart, including EMR, metadata, basic notes, and some images, might average 10 to 50 megabytes, which would be 120,000 to 600,000 complete patient records.
Ooh.
So that's big. And how they were able to pull it out, and if they got out like imaging and all, who knows? Maybe they did, maybe they didn't. But usually, as aggressive as these folks are, they're proud of what they did. Mm-hmm. So I'm expecting that to be proven to be true. Could be wrong, but I'm leaning towards maybe more.
But at least they're gentlemanly about it.
And they use gentle kill. But here's the thing that
if somebody's killing me, does it matter if it's gentle? I don't know. Maybe.
Yeah. Well, there's a song, "Killing Me Gently."
Kill me softly.
Yeah.
I guess.
Softly, gently. Come on, I was trying to make it work. Anyway, what I had originally planned before this attack made the news was for us to talk about the Black Fog report, their Q2 ransomware review that they do, where they look at actual ransomware incidents published on the dark web compared to the ones that are published in public.
Oh.
Yeah. And that they said that 97% of the ransomware incidents that they reviewed, which was over 2,000, just for Q2 2026, Q2, over 2,000, they reviewed, 97% included data exfiltration, the highest rate ever recorded.
Nice. Back to my things are getting a lot worse.
Yeah. I don't even think we were talking about that number when you were talking. Anyway, healthcare was the most targeted sector, accounting for 81 attacks, which was 26% of the total attacks.
Yeah,
And
we're number one. We're number one.
and well, they believe 87% of identified attacks are undisclosed
Oh,
because they're comparing what they're seeing on the dark web versus what they're seeing on public disclosures. And at least they can say that healthcare leads in disclosing theirs.
yeah. Which we always say that you take whatever number we know about, that is a small picture. And that's what they're saying. Most of them never get disclosed. You don't hear about them.
Yeah. Well, and they did not say that healthcare discloses 100% of the ones they found. They said healthcare leads in disclosures, which is good news. That means the majority of healthcare, we hope, is doing the right thing. But
Yes, we hope.
yeah, but it's like, I don't know how you think you can hide it anymore. And I think that's one thing. You remember, it was years ago when we were like, okay, something big has happened, and I keep waiting on this to happen in healthcare, where the attackers notified the SEC because the
Yeah.
company hadn't done it, and we talked about the notifying the patients. What are you going to do when they notify your patients?
Yeah. Because even if you happen to slip under the radar of media and all that, once the patients find out, dude, these class action lawsuits are quick.
Oh,
They quick.
Oh yeah, there's stuff. In fact, sometimes HIPAA consultants start working with somebody after they've had a breach. We've mentioned that we start working with them after we've had a breach, and sometimes after that they get subpoenaed for what they found, for the documentation for what they found. Oopsie.
Yeah.
And we are not known for over or understating. Everybody starts with saying we've overstated it until we provide all the evidence of our statement, and then they're like, "Oh, never mind." So, but for those who think this is a big health system and we're too small, it doesn't matter. We're not going to get hit. And I don't know. Did we decide how they pronounce this themselves? What they call themselves, or
I'm just going with CRPXO, but
I know
I'm sure it means something.
Yeah, I don't know
Crypto.
CRPXO is a ransomware group that emerged in late 2024, and one of the articles, I think Healthcare Tech News, Health Tech. Anyway, one of the articles mentions Healthcare IT News on the ANMED case, mentioned this one group, and it's a funky name, and I've seen it, but I haven't really paid attention to it. So I go to the link they gave us, the SOC Radar threat analysis on them, and their analysis is looking at July and August of 2026, and as of August 11th, so kind of goes along with this double extortion, which means we're going to steal your data and we're going to encrypt it. So you have to pay us twice, at least twice. They utilize phishing and remote desktop exploitation as initial access. And who do they target, David?
Small to medium healthcare providers, especially dental practices. Congratulations.
So small
Which
to
I
medium.
mean, if I was in the bad guy group, be my first thing. I'm like, dude, we need to go after dental, man. I'm telling you, these are easy.
Yeah, and so they employ the double extortion. They utilize legitimate system admin tools to be persistent. So they're living off the land, as they say. They publicly
Mhm.
leak the data to pressure you into paying. They'll go, well, we're only going to leak a little. And now they've launched an affiliate recruitment program to
I wonder what their
attract.
payout is.
Yeah, I know. But under the threat breakdown, aggressiveness. Oh, look, we've mentioned aggressiveness again. The
Yeah.
gentleman, aggressive. We talked about aggressive. The aggressiveness of this group that targets small and medium healthcare providers, 10 out of 10.
Oh, can't get more aggressive.
Mm-mm.
Hmm.
100% of the time, they leak the data.
Well, at least they're consistent.
Mm-hmm. Yeah. And they're not trying to like destroy your, operation at all. They're not trying to like kill your ability to operate, but they do want to hurt it. The criticality was 9.5 out of 10.
Yeah. So pay attention, in other words.
Mm-hmm.
Wow.
So we have now connected the dots.
Yeah, they're not going after the big guys. Clearly, they say they are targeting small and medium. So there you go.
Mm-hmm. And recruiting.
Ransomware
And
is
aggressive.
Yeah, everybody's aggressive. We should change the name of today's show.
Everybody's aggressive.
Connecting the aggressive dots.
Yeah.
Yeah. Now, so here's the question. If everybody starts being aggressive, does our threshold of aggressive go down so that now what was 10 today becomes 5 tomorrow?
At this point, we don't want to do math, David. We're done.
How many licks does it take to get the center of a Tootsie Roll Tootsie Pop? All righty. Well, there's a lot to think about over the weekend. I'm sure you'll be laying out by the pool like us and thinking about ransomware. But until then, stay safe. And that's our show for today. Thanks again for listening. And for Donna and myself, remember, the HIPAA's not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.